Are there medicines to manage my pain?
Supportive and palliative care is one of the most important branches of practice. In my practice, I make sure that the patient is comforted first, then the rest of the therapy will be accepted by the patient. Let me give you an example. Suppose you have fever. Maybe you got fever because of malaria, you could have got fever because of dengue. But if I don't give you paracetamol and reduce your fever, you will not have confidence in the fact that I am treating your malaria. So when a patient comes due to the diagnosis of cancer, it could be an early stage or an advanced stage, it becomes an absolute necessity as an oncologist for me to make sure that you are pain-free, you do not have any symptoms associated with cancer, and that makes you have more confidence in my ability to provide you the best possible results. In the case of early stage, I need to make sure that I cure you at the earliest instant. The reason is, once I cure you, you are not going to be suffering from the effects of cancer. If you are in advanced stage, most patients come to us with a lot of symptoms because of the spread of the disease. One of them is bone pain. Bone pain is as bad as probably what would happen to you if you develop these fractures. For example, you fall down and develop a fracture, the pain that you would have probably endured is the same that a patient with cancer endures because of the bone metastasis. So it becomes extremely important for me to make sure that the patient does not suffer with bone pain. So how do I do that? So we have certain medications which I would probably call it simply as bone cement injections. What we do with these injections is, once we give them through the IV route, these molecules will go to the exact areas where the bone microfractures have occurred because of the tumor eating the bones, and these microfractures are healed by this bone cement that we have giving them. So we have very affordable injections which are available for 3,000 to 5,000 rupees today, which will help you alleviate or reduce your bone pain to a great extent. Some people may come up with breathing difficulty. The breathing difficulty may be because of the fact that they have spread to the lungs. In those cases, we give certain medications, we give nebulizations, we give oxygen in certain instances, and then we treat them with the either chemotherapy, HER2 targeted therapy, or even hormonal therapy, by which the bone, the lesion of or the size of the tumor comes down significantly, due to which you are going to be relieved of your breathing difficulty. So it is a combination of the supportive or the palliative therapy and the definitive therapy. Definitive therapy means I am going to use either surgery, chemotherapy, or hormonal therapy, or HER2 targeted therapy, or radiation therapy to help you to manage your cancer in a more comprehensive way. Sometimes the patients may have back pain because of the the tumor and spreading to the backbone. In those cases, once I give them these bone injections, along with that I give them certain systemic injections or injections like chemotherapy. Along with that, if I institute physiotherapy, if I provide them physiotherapy, there are a lot of techniques in physiotherapy which helps to relieve your pain. If I provide all this, I am going to be helping you to deal with all the symptoms that you have in a much more effective manner. So to summarize everything, today's cancer management has to be comprehensive. Multiple specialties need to get together, because we are not just fighting cancer alone. We are fighting the patient who has a cancer growing inside him or her. So we need to make sure we provide the best of care so that patient is not only relieved of the symptoms but also relieved of the cancer.